Hello, good morning, good evening, good afternoon, and welcome. My name is Nurse Richard, the Wax Wizard, and thanks for joining me for episode 146. I think you're going to like this, those fans of skin peels. Now, this chap, he couldn't hear a thing in this ear. And you could see on the way in, couldn't you, just how dry and flaky that was. So he's obviously had some kind of inflammation, some otitis externa term for outer ear infection, inflammation, what have you. But as I just removed that little flake, you'll see what's happened is he's got this really thick layer of dead skin in the ear that's failed to migrate. Now, it does go all the way back to the eardrum, this one, and that's why he couldn't hear now, whilst he hasn't got a big blockage. So you see, all you need is a thick layer of skin across your eardrum, and your hearing will be severely impacted. So what I've done, I've tried first of all without oil, wasn't getting anywhere, and with ones like this, you definitely do need a good old dose of oil. Put some olive oil spray in this one, hence it's why getting it a little bit blurry. It's got a few on the hairs on the outside. We do try and wipe those off as best we can. The fine end tube, whenever you're doing peeling, you should always do it with the fine end tube, which, if you're not aware, is a little tube that you stick on the end of the full size tube. It's tiny, it's only about that long, and it's really thin, and it's better for doing peeling like this because it's less likely to make any whistling, squeaking noises as skin's flapping inside the tube. But these are beyond frustrating, doing ones like these, and you'll probably see why shortly, because whilst I've managed to lift it up, what I'm trying to do is get a grip underneath it there, because it's nice and wet and moist, that area, so you can get a good grip with that. So as soon as I get a good grip with that, I'm wiggling it side to side, up and down, and the reason for that is obviously to loosen it. But when you move it, the oil that you've already got in there will then slide a bit further down. It'll be able to get deeper down, so it'll loosen the bits further down, so when it comes to pulling it, it should pull it out. But it's beyond tricky. My plan was to try and bring this a little bit forward, and then I could grab it with the forceps. I did have a go at that in a bit. Bit too deep at the moment, I think, to safely go in with the forceps, and I'm not happy that I've separated it all from the canal wall yet, or at least the majority of it anyway. But what's really difficult here is I'm trying to get underneath it to that white bit there, and obviously trying to avoid that top bit from disappearing, it from getting in the tube. It's pretty tricky. So I managed it there, managed to get underneath, and then so let's go for a little wiggle and a jiggle again. You can see it rocking side to side, and yeah, every time a little bit peels away, and then oil will slide down that area, that little gap that you've just made. But they are beyond frustrating. Sorry if I seem like I'm a bit wet and sweaty here. It's been absolutely boiling here, and the phone's going again in the background. It's been really hot. We're having a mini heat wave here in the UK, which was nice because, like I said, I've only just got back from holiday. And you know, when you get off the aeroplane, if you've been away somewhere nice and warm, you get back and you're hit with that either rain or cold air, which usually happens when we land at Manchester Airport. But it's been absolutely scorchio. But unlike where we're on holiday, we don't have air conditioning, so it's been boiling. It's unpleasantly hot, and the problem is in my room. So you can listen to these procedures. You can see I'm just going in with the forceps here. If I leave the window open while I'm doing these procedures, that's all you'll be able to hear. You won't be able to hear any of the procedures. You just hear cars, fire engines, buses going past the window, and it distracts you, and you wouldn't hear the procedure as well. So when somebody's in, I keep the window shut. Just for you guys, I suffer and get sweaty and hot just for you guys, so you can hear this kind of stuff. What I've done here now, because the forceps didn't work, it just peeled through it. So I've changed to the full-size tube, hoping that it doesn't squeak too much. You can see a little squeak, but nothing too major. And as you can see, it pulled it up from the eardrum, because we'd loosened it and separated it. It pulled it all the way up from the eardrum, and both the patient and me were really surprised as to how much difference it made to his hearing. Just having this relatively thick layer of dead skin just on his eardrum, it was like somebody had turned the lights on. You know, it was fantastic. He really grateful. Anyway, glad you enjoyed that. We're back to relatively normal in the clinic, so hopefully I'll be able to get plenty more videos out for you soon. But for now, take care of yourselves, and I'll see you later. Bye bye.